Hello, everyone. You're welcome to another episode of Early Intervention Matters podcast. I hope you've all had a good month. It's surprising that the month is running fast ahead, but we're excited at Early Intervention Matters podcast for what we have in store for you. So today we have a very special guest. Um, she is from the field of dentistry, and we're going to have a conversation today about dentistry and dental problems in neurodivergent children. As you know, the Early Intervention Matters podcast showcases different topics around neurodiversity. So I've got the pleasure of having Dr. Ivy Fortune Glavee with me. Call her Ivy. So for the purpose of this podcast, we'll be referring to her as Ivy a lot. And so Ivy is someone who I've known for several years now. We've worked together on a different platform, again, talking about neurodiversity. But Ivy is a very experienced dentist. She's done quite a lot of things. And I'm just going to give a very brief introduction, and she will possibly tell us a bit more about herself when she comes in. So Ivy is she, apart from being a dentist, she's a clinical entrepreneur. She's been a TEDx speaker. She's a content creator, a poet, an artist. She is an innovator and visionary professional. She's been an author. I think I will do well by asking Ivy to just give us a brief introduction about herself, because I don't think I can do it as much justice as she can. But welcome, Ivy, and thank you for joining us on this podcast.
Thank you for having me. Thank you for the introduction. I think you've said everything.
Okay. I'm sure we'll have a bit more about you as we go on. So we decided to have a topic on your dental challenges and dental problems in children with neurodiversity, because we know this is a very, very common concern. Just as we look after our bodies, we also have to look after our teeth, because it's pretty much part of showcasing our health and well-being. And many times people forget about the dental aspect that is as equally important as every other thing that we do. And we know how difficult sometimes it can be, because, our teeth, getting in there, even for adults, for people who are neurotypical and adults, sometimes we do not like doing the things that we need to do to keep our teeth healthy. Sometimes that can be uncomfortable, but today we're going to hear from Ivy about dental well-being, about how parents can support children who are neurodivergent. And hopefully by the end of this, we will have some information on how best to do this. So, Ivy, just as a starter, I think it would be good to first of all just talk about what do we mean by normal dental well-being in children, normal dental health or good dental health.
Very good question. Well, when we mean dental well-being, it means their mouth are developing and functioning in a way that supports their overall well-being without any disease or dysfunction. So it means someone who visits the dentist regularly, someone who is registered with the dentist maybe from the age of 6 months, someone who is able to brush their teeth and do not have any tooth decay or any pain, and they are able to speak properly. So those are the things that is the norm. But yeah,
That's interesting. I think you've touched on something, saying someone who is children to be able to get to the dentist quite early as 6 months. I think some of our audience will be wondering, is that not too early?
I am happy to see children as young as 6 months old. The reason why we say 6 months is because we believe the teeth start developing at 6 months. But there are some people who are delayed. Their first teeth may come at 7 months, 8 months, 9 months. I do not want any parent to be worried, because we are all different. So the question is, when is the best time to register my child with the dentist? And the answer is, as soon as the child has got teeth in their mouth, register them. because the earlier you introduce them to the dentist, then you are able to build a rapport. From what I know, some neurodivergent children, they like routine. They like to see the same person. They may want to come at the same time. They may come with their own comforter. There is something called normalization. Normalization means some parents even come with their children who are neurodivergent and they don't even tell me. It is only halfway through the examination they will tell me, my child has got ADHD and it's a mild one, or my child is taking melatonin. That's how I get to know. So some come in and they are so calm. And the reason is because when I see a child for the first time, meeting a child for the first time is like building a relationship with them. So I'll start and I use the tell, show, do technique a lot. And I'm going to talk about that. So if I see a child for the first time, I'm not going to say, oh, this child is neurodivergent, because you never know what
Mm.
someone is going through. Some people are neurodivergent, the parents will never tell you and you cannot see it. So what I tend to do is any child that walks through the door, I use the tell, show, do technique. And one may ask, what is it? So when they walk through the door, I'll say, hello, how are you? And then I'll tell them, do you want to sit in the magic chair? The magic chair is the dental chair. Some do not want to sit in. And I'll tell mom can hold them on the lap as though they are breastfeeding them. And then we'll be able to have a look. Some wouldn't want to open their mouth, but you have to get the parent involved. So that is very important. So I'll tell them this is the magic chair. And then I'll say, oh, this is the mirror. I can even give them the mirror to hold. And I tell them today, all I'm doing is just having a look and counting your teeth. And that is so it is a gradual process. And if they allow it, then move on to the next stage. So you've got to respect those sort of boundaries. You don't do everything in a go. So I hope I've answered your question.
That's really good, Ivy. And I like your approach of taking it gently, because whether the child is neurodivergent or not, I think what you have used as an opening to get them relaxed will work for most children. So I just like the approach that you're using. And the other thing you have said is you don't have to do everything on one go. Sometimes I think that's why sometimes everybody's anxious, because they just think, today I'm going to get all this done. And the child and the family start getting worked up and anxious about that visit. So yes, thank you. That's really good information. So moving on from dental well-being, we've seen many children with neurodiversity, autism, ADHD having more dental problems, tooth decay, gum disease. Is there any reason why they are more prone to it? Is it because they're neurodiverse that makes them prone, or what are the reasons that makes them suffer more problems?
So the reason is because every child is different. And there are times you have to tailor make your treatment to a child. The way I look at it is looking at the five senses. And people who are neurodivergent may have sensory. They go by their sight, what they hear, the smell, the taste. All those are very important. A child can walk through the door and tell you the room is too bright. Can you put off the lights before you see them? You've got to listen to them. Some may come into the surgery and they may tell you, I don't like the tablet in the water taste. And you got to respect that. Some may come in, they have their comforter with them. Some have got a name for their comforter. They call it a blankety or a favorite toy that they hold on to. Some may come into the surgery and tell you, I want to watch a certain movie before you are able to see me by sight, smell, listening. They may want to come in when it is very quiet. So every child has got their own peculiar things that is very special to them. Some of them have got names that they want you to call them by, and they even have names for their toys. So there are times when I'm doing the toy show, for example, if they got the toy and it's called Blackety Blank, I'll try and say, can we look in Blackety's mouth? And before looking at yours, and try to get the mom or the dad or the carer involved. It's very, very important. The parents need to play a very good role in that. So in answer to your question, because with them, because of sensory and things like that, there could be an overload. So you have to be very careful with them and find out what works for them, because everybody is different. So what you and I take for granted, like sight, smell, in them it is over, it's in excess. So you have to find a way around it. That is why I've given those examples like taste, smell, what they even hear. Even at times I ask them, what's your favorite music? So I can play that music, or I can tell them, bring your own music to hear. Some don't want to hear any noise at all, and they may even want to cover their ears. You have to watch, listen, and tailor make your approach to every child. I don't know if I've answered your question.
Yes, and I also asked that why are they more prone to having tooth decay?
The reason they are prone to having to decay if, for example, in the norm is to brush twice a day. And some of them they may not like the taste of the toothpaste. That's an example. Some of them are very specific. They don't like particular flavors. Some of them don't like even toothpaste that full. So if they don't like those sort of textures and they feel it, they wouldn't want you to brush their teeth. And in order to have a healthy mouth, a healthy gums and confident smile, you need to brush twice a day. And some parents struggle even having them to brush once a day, because you have to listen to the child. Does the child like the toothpaste I'm using, or should I change the toothpaste? So things like that. And then some of them too are on certain medication. I'm not going to mention the medication here, but some medications that are able to monitor their moods and things like that. Some of the side effect is dry mouth. Now, when your mouth is dry, you don't have enough saliva to wash away any debris or food. So what happens is that you are prone to higher decay. If you don't brush, you are prone to higher gum disease. So these are the things that can make it very difficult for them. So you have to make that extra effort.
That's really important. Thank you. And we can now see why it's easy for over time um, gum disease and tooth decay to build up in them. What are children with ADHD? How does it affect oral behaviors as well? Is it the same thing?
Yes, this is the same thing to do with the taste. Maybe some of them don't like their teeth to be brushed. Maybe
Yeah.
the type of brush. If you're using an electric toothbrush, maybe the vibration. And then if you are using a manual toothbrush, you have to use a medium bristle. Maybe they don't like the texture. And maybe either you have to look for one you have to do things that will make them feel like brushing their teeth. And if you are going to reward them, and especially to what I've noticed in some neurodivergent, some parents to tell you, this is the only food my child, some of them are very particular.
Yeah.
There's particular food that they like. And unfortunately, some of those food are very high in sugar. So you have to have a compromise. Because if that's what is keeping the child alive, then you have to find a way around it. So what I tell them is your child can have sweets, but let them have it after food. They can have juice or whatever, but let them use a straw. So it goes straight to the back of their throat. So because if I know some of them become fixated on a particular type of food. If unfortunately that food is full of sugar, then you're in trouble. They are going to be prone to high decay.
Okay. I think that's so important for our audience to listen to, because I like what you've said, that if they, sometimes it's difficult for parents to just take away particular food, but it's about giving it safely so that it's not impacting on the dental health. And I like what you said about using straws to drink so that it doesn't then sit on the teeth as well. How can parents then tell when the child starts having dental problems? Because it's very difficult. One of the difficulties with children who are neurodivergent is communication. Many of them cannot communicate. They can tell you when their teeth is hurting. Sometimes parents will find out really late when the problem may be more advanced. So what do you advise parents to do?
That's a very good question. So you know your child, you are with your child, let's say 24 hours. But if a child is nonverbal and we notice one of the key, the child refuses to eat. There's been instances that children refuse to eat and people even forget that the child has a toothache or there's pain in the teeth. And the child starts losing weight or something like that. It's not eating properly. Then some of them realize that it's something to do with the mouth, or they wouldn't want you even to go near the mouth. Maybe they are nonverbal or things like that. So there are times that if there are special cases of children that they are nonverbal, they can't do anything for themselves. I remember there are times you have to work with the doctors, the consultants, and then you have to come to an agreement as to what is best for the child. And when that happens, they put the child to sleep. That is general anesthesia. And at that treatment, they are able to clean the teeth and remove any rotten teeth that is there, because that's a child maybe who is uncooperative. Because at times we use gas, at times we use Telshore. In practice, I use psychology like Telshore technique. But in the hospitals or community, they may give them gas, and if they can't tolerate it, that's when they move to GA. But if you are moving to GA, you can't just make the decision on your own. You need consultants, you need a shared decision, what is best for that child. And when you get the child for the GA, you have to make sure you do everything. You have to sign consent, assent forms. If it is rotten teeth that is there, you have to remove it. If it is cleaning, you have to do all the cleaning. So in doing that, you are sort of managing what is good for that child. Yeah.
Yeah. And I think I like what you said at the beginning, that some of the things could be just simple as a child not eating or refusing food. When we see some children within our hospital or the setting where parents have come and the child is so unsettled, the child is irritable, there have been cases where the school have said the child is so unsettled, is not themselves. They go to the GP, they have blood tests done, they have all these things done, and that's fine. But the child is still unsettled. One of the key things I learned was always think about dental as well. Because if you're having your child where the behavior has just changed, and like Ivy rightly said, not eating properly, then, we should always think whether the child is having any dental concern, and it will be useful to see whether we can get your child to see a dentist for a proper checkup. Is that what you would advise, Ivy?
Well, what a lot of parents don't know is that in dentistry, we have general dental practice. That is registering your child with the dentist. And when you register your child with the dentist at an early age, as I said, the reason I say 6 months is because we believe it's around the age that some children have their teeth coming through. But there have been instances where children are born with teeth in their mouth and they have to remove it, because if they don't remove it, parents cannot breastfeed the child. And so that is an exceptional. So in that case, you are building that sort of rapport. It has to be very gradual. So that is very important.
So I think one key message that we have brought up from this is about uh, parents being aware that if your child's behavior is changing, if your child's feeding pattern is changing, or there's just something different and you can't seem to, you know, find what is wrong, and the doctors have checked and they can't seem to find what is wrong, it's good to also think about dental. uh Sorry, Ivy.
Yeah, I just remembered. So in the past, people with neurodivergent, we call them special needs. So they are seen in community dental practice. But now we don't have community dental practices. We have special needs departments. So if, as a parent, if you're able to get your child into a special needs department, dental department, or community dental services, they take over the child's oral health care, and you are able to have your peace of mind. So there will not be any instant that you have to say, oh, I can't take the child, because they will always send you reminders. They take control of the child's oral health care. So if you are able to get into a special needs department or community dental practice, it's different. That's where they are there to deal with all the special cases that cannot be dealt with in general practice. But things are changing, because there are times parents have difficulty gaining access to those services, and they have to fall upon those who are in general dental practice. In general dental practice, it depends on the clinician that you see. Has that person got experience seeing people like children? Some people are used to seeing adults. Some people are scared of seeing children, because with seeing children, it's a different ball game. You need to have a lot of patience.
Yeah. So how do parents register for that community dental?
Oh God, things have changed now. In the past, which I've been part of, we used to go to the schools. We used to go to the special schools. which we call screening. I
Yeah.
remember I used to see about 300 to 500 children in a day. So you go to the school and all you do is screening. All you do is use a mirror.
Mm.
You don't use any instrument, just a mirror. The child opens their mouth and you are looking for decayed teeth, missing teeth, any orthodontic problems. But before you go to the school screening, parents have to send in a consent form that I'm happy for my child to be screened. So
Mm.
if you see any problem, you write it and then you give it to the teacher. So after you finish, the teacher contacts the parents and the parent is then sent to the community dental department or anywhere that is closer to them. But now, because of funding, I think all these things have stopped now. And there are times too when the some GPs don't like doing it because it's like they've got so much to do. But some of them are able to, if it gets really critical, they're able to write a letter and then have it sorted out. But most GPs feel anything to do with dental, you should go to the dentist.
Mm.
Or the best thing is to first line point of call is to go to your dentist. And then if the dentist cannot deal with the issue, the dentist can
Mm.
refer to the hospital or refer to the community dental department. So it all depends on your dentist or your area where you are. Yeah.
Thank you.
Yeah.
So, just coming to what happens because part of the majority of the problem is actually getting the child to the dentist, and then while the child is there, being able to cooperate with the dentist. So, how do you manage when the child has challenging behavior, meltdowns, or outbursts in your practice?
So when that happens, you've got to respect it and then tell the parents, can you bring them another day? Maybe today you're not feeling it or they don't want to be seen. They're not being cooperative or something like that. But I get that rarely because what I try to do, I try to make it as fun for them
Mm.
and for the whole family. So I'm going to share with you what I do and the terminologies I use to communicate to them in simple language. So, for example, if they come in, I'll tell them this is the magic chair. Maybe introduce them to the chair. There's a 3-in-1 air that we use. I call it Mr. Windy Bendy. So you just blow air on their hand, tell shoulder technique. If you are going to just check, you give them the mirror, just say, I'm just going to have a look. And then at times we apply fluoride. Fluoride is found in toothpaste. Whenever the child visits the dentist every time, we have to apply it because it's part of prevention. You tell them, so after you've done that, you just say, well, the checkup is done and that is it. We've counted the teeth. If the child is not being cooperative and wouldn't allow the mirror into the you have to be careful. At times you have to use a protector so they don't bite your fingers. The mom or parent will hold the child. Like I tell them they should hold them as though they are breastfeeding them. And then their head is this way. So you're able to, so when they open their mouth, you are able to have a look. And then later on, bring them back maybe in 3-6 months. You don't do any major thing. The fact of seeing them and then just looking with a mirror and checking whether there's any decayed teeth, any missing teeth, if there are any issues, then you reinforce oral hygiene. Personally, I'm very passionate about prevention. Prevention is better than cure. And the reason is if you're a mom and you are breastfeeding, the baby. As soon as the baby falls asleep, please remove your breast from the child's mouth because there's something called nursing caries. And if you don't take care, it's going to rot the child's teeth. And that's even going to give you more stress. Do you know that in this country, they spent about £75 million in 1 year, 2024 to be precise, just to put children to sleep to have their teeth removed? Dental prevention is very, very important. And the reason I'm saying this is when I was doing my research, my master's degree, I was asked to evaluate the Sure Start area and I had to speak to the parent, the health visitors. Health visitors are very, very important because as soon as the parents come home, the health visitor is the first person who is in touch with the mom. And I remember during the Sure Start area, they used to give them a pack. In this pack was oral hygiene instructions, a feeder cap, a toothpaste for the whole family. So the health visitors have got a very important role. Unfortunately, most of them have not been trained to give the same message. So they give different messages.
Again.
It would be nice to empower those health visitors to be able to, this is based on my research, to give them more information. And that red book, there isn't a lot of information on dentistry. So I think it would be nice if we could maybe come up with something that would even start encouraging parents and all these problems will be solved. Anyway.
I agree with you, Ivy. I think there isn't enough dental education out there. And I also agree with you about prevention being better than cure. I think that's one of the reasons that also drives me doing the podcast series, because you want parents to try and intervene early, and pick up things early before things actually deteriorate. And I think that's really good information that you have given about nursing mothers, because these days when we promote a lot of breastfeeding, nobody goes beyond that to tell the parents about it's good to breastfeed, but you need to start thinking about preventing dental caries in your child. It's something that I'm sure a lot of people would not have thought about, but thank you for highlighting that for us. So I take it that when you have a child in your practice who is struggling and cannot settle, because you can do all the good things, and it's amazing thing that you're doing to settle them, but you could still have some children being quite difficult. What do you do during those times?
So, as I said earlier on, to be honest with you, because I've seen a lot of kids for a long time, I don't know. I rarely refer them the next stages of the hospital where they may have maybe sedation, RA, or the worst case scenario is general anesthesia. If you practice, I'm very proud to say I've seen a child from baby to adulthood without a single decay, and this child was
Wow.
neurodivergent, and I'm very proud of that. That
Yeah,
the child never had any decay, because the simple message I always give is brush twice a day, limit sweet to meal times. If they are going to have any juices, use a straw or a feeder cap. If they are using a feeding bottle, as soon as the child falls asleep, gently take the feeding bottle out of the mouth. It's all this little thing. And then there's an app you can also download. If there's any parents listening, you can go to your app store. They don't pay me for this. I'm not advertising. This is for NHS. It's an NHS app. And if you go to your phone, your mobile phone or your app store, it's called Food Scanner. It's a yellow Lego. And what it is that you can use that scanner. As soon as you download that scanner onto your phone, you can just start scanning any food in the house. It tells you how much sugar in the food and just tells you, and it's got recipes, and it tells you what you can swap it for. So that is very useful for parents. Yeah.
That's very valuable information. Thank you. Some children have an experience at the dentist that traumatizes them, and they don't want to be back at the dental clinic again. So what's your advice, and how do you approach such situations?
That is why prevention, introduce them earlier to the dental practice at a young age, so that you start building a rapport, so it doesn't even get to that stage. So if, for example, they've got cavities and things like that, there's a filling I use which sort of repairs the tooth, and it doesn't involve a lot of drilling. You can just clean it and then fill it to repair the tooth, and then you can review the child. In doing that, you are building their confidence. Or at times you may have parents come in and said, oh, the baby tooth has come through, but the adult tooth is coming behind, which is normal. But there have been instances a parent will come and said, you know how children can be very funny. When the new one is coming through, it seems they have too much and it's crowded, and they may be teasing them at school. So mom will say, can you take off the loose tooth? So if I'm seeing a child for the first time and they are worried about extraction, I'll tell them, I'm going to give you 3 months to try and wiggle it out yourself. So if you can't do it, come back in 3 months and I'll be able to do it. But when you come back in 3 months, this is what I'm going to do. I'm going to use the magic cream. The magic cream is a topical gel I normally use because it numbs the area. And then I'll tell them, you feel a scratch. The scratch is the local anesthetic. So I never say needle, because I said, have you been scratched before? I said, yes. So you feel a scratch, and then you feel the magic water going in. That is the local anesthesia. And it goes all tingly and funny. And then you may feel numb, or you may think your face is swollen, but it's not. And then we'll do the wiggle dance. First of all, I have to go around the tooth to see if it's numb. And if I'll tell them we'll do a moonwalk dance, and then they'll start laughing around the tooth to see if you are in pain. Because if you are numb, you feel pressure, but you should not feel pain. And then we'll do the wiggle dance. Wiggle, wiggle. Let us do the wiggle dance. Wiggle the tooth out. And then you're going to get some money from the tooth fairy. So I've prepared this child that this is what I'm going to do in the future. So by the time that child comes, and I tell them, if you're coming, come with your favorite toy, favorite music. So it's like I've sort of prepared them. The worst thing to do is not telling them what you are going to do, not
Mm,
showing them what you are going to do, and just
mm.
doing it. They don't like that.
Yeah, and it can be very destabilizing for them, them coming into the dental practice, then somebody coming to open their mouth. Even as an adult, I don't like my visits to the dentist. I start getting anxious the day before. My blood pressure goes up, and it's not until that visit is over then I'm settled. So I can imagine for for a child who is neurodivergent, who doesn't, who's not aware, it can be very frightening. So coming to toothbrushing,
Mhm,
it is a very challenging time for most
mhm,
parents.
mhm.
A lot of parents will describe the challenges they have with getting the child to. So what's your advice? How do you advise parents to approach this?
I know it's really hard. Some of them have told me that either you're going to you have to find a way. Every child is different. Either you help them, or at times I know some of them are left to do it by themselves. There's a technique to brushing. So some people think electric is much easier. The only time I recommend electric is if you are very heavy-handed or maybe the child cannot hold. But even then, there are some toothbrushes that can play music, their favorite music. And whilst they are brushing, they can be enjoying brushing. If you are going to do manual, you have to use the roll technique. Don't brush horizontally. You have to hold the toothbrush at an angle of 45 degrees and do it gentle and then flick it down and then up. So don't do it horizontal because it leads to gum recession. So you have to try to make it as fun. Some parents, I think they tell me the child bites hard on the toothbrush and it's very difficult. So in that respect, there are times you have to bring them to the dentist if it becomes hard, because if there's a lot of buildup and you are not able to brush it, if it's soft, you're able to brush it, that's plaque. When you wake up in the morning, that stuff you see on your teeth is plaque. But if you are not able to brush it away and it becomes very hard, like calculi or tartar, then you need the dentist to use a special instrument to clean it. But with neurodivergence, some of them don't like the noise, the
No.
vibration, and the drill and all those sort of things. That is why it is important to try and find a way to make the brushing fun for them, or maybe reward them with something. For example, my reward for them is a sticker. So maybe before they even start crying, I'll show them the sticker, tell them to pick it, and then say, now you've got to work for it. We've got to check your teeth. Something to reward them to make them feel good, not sweet or something that they like. That if
Yeah.
you brush, you have nice teeth and things like that. And then regular visit to the dentist. So if they have a dentist that they see regularly, if it's getting worse, the dentist will be able to pick it up rather than leaving it and it becomes worse, and the stress of the child being in pain, and then you have to do something about it. So it is best to start at an early age. So that's my only advice. We start early, bring them early, and then take it
And I
from there.
think when you start early, the child starts getting used to the dentist as part of their regular routine. And I think that helps as well. I also like what you told us about you, like from what I can see in your practice, you pretty much engage the child as part of that journey. I think what happens sometimes is that children are not spoken to, and the parents bring the child, and the child is wondering what's going on, and the next thing they say put them on the chair and this, and so I think the approach that you've used, where you've gone very gently, gotten children to engage with part of that process, has helped with the successes that you're getting from there, and which is a great thing. What can parents do to prepare the child for the dental visit?
So last time I had a parent come in and I was so impressed. The child said, this is my child's first visit to the dentist. And the child had some wooden toothbrush, and a mirror. And the wooden mirror had a proper mirror surface. And I said, this is the first time I've seen such a kit. And at
Mm,
times there are some books that people can read to their kids to sort of like prepare them for
Mm.
their first visit. My first visits with children is always checking with the mirror and then maybe apply fluoride. Some of them will tell you they don't like the taste. If the child doesn't like the taste, you respect that.
Mm.
Some of them will even remind you and tell you the last time I came, I didn't like that taste. I said, okay, if that's fine, then I respect your wishes if you don't want it. But I
Mm.
get to explain to their parent that they should try and get it in maybe toothpaste appropriate. Or
Mm.
there are special toothpaste. Some of them don't like they don't like the foaming one or
Mm.
flavorless. They don't want any flavor. And there are toothpaste out there. There's one called Oraness. There's no foaming for kids who don't want any taste at all. They don't
Mm.
want any foaming. They want it bland. So
And where can parents get this special toothpaste? Is it in the
everything
regular?
is online, but you cannot tell which one is safe or not safe. Yeah, this online. Everything is online. Yeah.
Okay. So parents can help to prepare the children for the visits.
Yes, 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 yes.
That's
Yeah.
good. And a lot of children, obviously, with dental, who are neurodivergent, have sensory issues, and this can cause a lot of problems with them. So, how do you deal with the anxiety and sensory issues that you pick up in your dental practice?
If they come in and they say the light is too bright or the light in the surgery, they don't like it. Okay, I put it off. Some of them will be standing. They don't want to sit. If they don't want to stand, I'll just said, okay, just open your mouth wide. I'm not
Mm.
doing anything. I'm just counting. And then there is something called modeling technique. Modeling
Yeah.
technique is when they come in with their siblings. So if they have if for example, they have 3 kids and
Mm.
the youngest is about 7 months old and they all come together, seeing the one who is more cooperative doing it, they are able to copy that one. So if this one has been able to go through it, then they know they can also do it. They find it a little bit easier. So if you have children and you want to bring them to the surgery, you can bring all 3 at the same time. Make sure the person who is scared watches what you are doing to the other ones. Yeah,
So that's really good.
modeling technique. Yeah.
Yeah. That's good. So, and what do you, just coming back again to professionals, so what's your message for professionals? Because lots of professionals are seeing children, non-dental professionals I'm talking about now, therapists, pediatricians, GPs, people are seeing children at regular times. But I can bet you not many really would ask about the dental cares within their regular clinic appointments, and what's your advice, and what are the things that clinicians listening to this podcast need to do when seeing neurodivergent children?
So if the child is not eating or some losing weight, obviously there must be something going on up here. And practicing prevention, I think it would be nice to have some collaboration with dentists, whereby dentists and clinicians can come together and maybe share knowledge and maybe signs or things to look out for. Because the way I see it, I see the mouth as a mirror of the body. And
Yeah.
there's something like oral manifestations of systemic diseases where there are times the child may be poorly and it may show up in the mouth before even showing up in the whole body. Some may come with candidiasis or things like that, and they know the child is poor or immune system low. You just pick up a lot of things from the mouth that maybe even they are not even aware of, or easily bruise, or maybe they've got underlying blood diseases or things like that. That's why medical history is very important, whether they're allergic to penicillin and things like that. So there are a lot of things that one can share knowledge. We can all
Mm.
share. We can all learn from one another to
Yeah.
what we can look out for. I know
Def-
we always receive training to look out for other things when we are looking at a child, bite marks and things like that. Whether a child has had a fall and it doesn't match with what you are being told, whether there's been trauma, whether the child is grinding their teeth. There have been instances where you pick up on that, oh, the child is grinding their teeth. That's an example. And then
mm.
I'll ask the parent, as the child, have you recently moved? Or is there anything going on? Or you've moved home, or the child is not happy at school and things like that. Because at times grinding of teeth, even in children, could be signs of anxiety.
Mm-hmm. Mm-hmm. That's interesting. Yeah. So I do feel that there needs to be a lot of dental education for clinicians. It's my take. I do feel that lots of clinicians, including myself, we need to be more proactive as part of that early intervention so that when we see children in our clinics, and this message is for all clinicians out there listening to this, if you see children in your clinic, as part of seeing them for their overall well-being and their neurodevelopmental progress, it's also good to ask about dental health, because maybe by prodding the clinic, the family, and talking about that in another setting reinforces that message to, and also all the great tips that you have shared with us, Ivy, about, the nursing mothers and, breastfeeding, when we're giving children feeds. I think these are just all valuable information that I do hope that if their families or professionals or clinicians listening to this, they will be able to pass on that message to ask. Because if you're seeing people regularly and asking, how are you? How is your health? How's this development? How's your dental health? Find out about the dental health. It should be part and parcel of the questions that we ask. Yes, thank you so much, Ivy. And I do like the prevention that work, especially that you're doing. What we've talked about what parents and carers can do in preparing the child for the dental appointment. Roughly how many times should a child see the dentist in a year?
It all depends. Ideally, it's supposed to be every 6 months. But if a child has got a lot of decay,
Yeah.
so if a child has got decay and they come in and you do 3 or more fillings, then you need to bring that child back in 3 months. And the diet is very important. Now, one may ask, what is tooth decay? Tooth decay is when the bacteria in your mouth adds on the sugar to produce acid, and this acid attacks the teeth. That is why I never tell parents, life is already tough on parents. I never tell parents not to give their children a treat. Everybody deserves a treat, but it's to do with the timing. So if you want to give your child a treat, it should be after food. If after food you want to give them the whole of this room, I wouldn't bat an eyelid. But if you give it to them every constant, it means their mouth is always acidic. And that is not very good. So at times the mom will come in and said, oh, tell them not to eat sweet. And I tell them I'm one of those dentists that never say that because it's not realistic. If you tell their child not to eat sweet, they are going to go behind your back and eat it. The best time is tell them after meals. So anywhere they go, they know that after food, they can have a sweet, a treat. And the reason is because after meals, we salivate a lot and it's able to wash away the acid. And also juices. Some people say, oh, my child only takes healthy drinks, only juices, but juice have got acid and things in it. So use a straw. Even if you dilute it, the pH may be the same. So you can give them water, milk, or if as a treat, please use a straw. Yeah, because sensitive teeth is very difficult to treat. And if a child has got a sensitive teeth, they cannot tell you that I'm sensitive. And it's maybe due to the acid.
Yeah. Are there some hereditary dental problems?
Well, an example is diastema. So diastema is when you have a gap between your teeth.
Yeah.
And so some people inherit it. In some parts of the world, it means you are beautiful, but some people too want to close their gaps. And then we have some people who have missing laterals, and then some people have different type of deformities of their teeth, like hypoplasia, or people who have got maybe for a dance or things like that, maybe less teeth, they may be prone to a lot of gum problems and things like that. So there are a lot of things out there that,
Okay.
that can
Great.
be. Yeah.
So we're coming to the end of the conversation. It's been a great one, Ivy. Thank you so much, because
You're
I have
welcome.
learned a lot, and I'm sure the families have learned a lot as well. And in your day-to-day work, obviously you see lots of children with special needs and oral health. Is there any innovation that is come up that you want parents to know about?
My innovation, which I'm working on, is a screening tool now. So my innovation, I didn't know you were going to ask me. My innovation, I've been working on this for so many years because I've been a dentist for over 29 years.
Wow.
And I've always been passionate about empowering people to be responsible for their own teeth. So
Yeah.
what I came up with was using your mobile phone to take a picture of the occlusal surfaces of your teeth, and you send it to the AI agents, which I've developed or built. And this AI agent is able to tell you if there are any signs of tooth decay before it becomes a big cavity. The reason is because when the teeth, do you know you can repair your teeth? So if, for example, you have tooth decay, you may have a white patch. If you ignore it, it progresses to brown. And then at times you see kids with black teeth and parents wonder what it is. So there are times if a child is eating a lot of sweeties, they have cavities. If you stop them, the tooth repairs itself and it may show as black. So these are things that you can pick up for yourself. So that is why I have innovated this, and I'm hoping one day it will go global so that people can empower themselves. So that
Well
you don't
done.
have to wait till it gets really bad
Yeah.
before going.
Well
So you're
done.
intervening.
I think that would be good because obviously we know there's shortage of dentists in the country. And one of the huge barriers has been people being able to get dental appointments. Education is so important. Giving parents tips for keeping the teeth healthy and giving parents tips for identifying when something is gone wrong on time is so important rather than waiting for when things have failed.
Yeah. Even tooth sweetness. At times people they say the child is crying and they start putting things in their mouth. It even changes the shape of their teeth. And some of them end up with orthodontic problems. And then
Yeah.
another question people will ask me, well, they are going to lose their teeth. Why do you even fill them? And when I hear that question, it's upset me in a way because the baby teeth are so important. They are there to guide the new ones through. When you take out a baby tooth at an early age, it takes a long time for the adult teeth to come through. And then they are also there to maintain the space for the
Yeah.
new ones. So if you take them out quickly, then they start having orthodontic problems. And then if the tooth decay becomes so bad, then they have to put them to sleep to take the teeth out, just to remove teeth that are rotten. And this could have been prevented. So I believe education, like what you are doing a great job, because with this, Mom's always been passionate about prevention, intervention, early intervention. It saves a lot of money. And
Yeah.
knowledge is power. Knowledge, attitude, behavior, the CAP model.
Yeah.
Knowledge changes attitude and it
Yeah.
changes behavior.
Yeah, absolutely. And you're doing a fantastic job, Ivy,
Thank you.
with what you're doing. I think this message needs to go out to lots and lots of forums. I do say again, professionals need to be educated as well. So just to round up our session, it's been a great session. We've heard from Ivy about dental well-being. She's taken us through what makes good dental health, how early to start. Don't wait until children are a few years old. Start as soon as they start having teeth in their mouth, regular dental checkup. And she's giving us very practical solutions about day to day oral care. And it's not that you're denying your children of treats, but give it to them after food. She's explained that beautifully why that is important because you get increased salivation, which helps to detach things and doesn't allow accumulation of things that would then result in bacteria growing. She's explained to us about how to support your children with brushing, regular toothbrushing. And she's talked about how to pick up signs of early dental problems and also talking about what to look out for in your child. If there's a change of behavior, your child is not eating, what this could indicate and how to get help on time. And, we've talked about why dental hygiene and dental education is very important. So just a few last words, Ivy. What's your last words for parents today before we round up?
Dental prevention is better than cure. Brush twice a day. Limit sweet to meal time. Spit after brushing. Yeah.
Thank you.
Thank you.
It's been an amazing session, and we're so, so pleased to have Ivy. We look forward to having her again and look forward to that amazing, innovative tool that you're bringing out, which I believe is going to be very, very good. So thank you so much for spending time with us. Thank you for sharing this very, very useful information and practical tips for parents. I'm sure many parents are, going to want to reach out to you, professionals too. Where can we find you? Can you give us your details and how people can connect with you?
I'm on LinkedIn, and I'm also got a channel, a YouTube channel, where I share everything about dentistry. And the YouTube channel is Dentist Fortune. And yeah, so those are the two places you can contact me. Yeah.
So I think we will put that information as well when the podcast is being released, so where we can find you so that parents can connect with you. Thank you.